Hey future nurse, let's talk about diuretics. This is a commonly tested topic on the NCLEX, so let's get right to it. Now, potassium is really important when we're talking about diuretics, and I always want you to ask yourself, is this diuretic a potassium wasting or a potassium sparing? And let me know in the comments some of the risk factors associated with hypokalemia and hyperkalemia. Now let's talk about potassium wasting diuretics. This can be broken up into two drug classes. We have our loop diuretics, which is furosemide and bumetanide, and we also have our thiazide diuretics, which is our hydrochlorothiazide and chlorothiazide. Now, what potassium wasting indicates is that when you administer this medication, you are administering a diuretic that is going to cause the patient to excrete fluids via urine. And with the excretion of fluids, you're also going to have potassium flying out of the body. So that patient is going to be at risk for hypokalemia. As a nurse, you always want to monitor potassium levels prior to administration. If anywhere on that NCLEX question you see furosemide and you see a potassium level under 3.5, take a step back and know that that's a red flag. Also, a tedious detail here is that licorice in combination with these potassium wasting drugs, specifically loop diuretics, can worsen hypokalemia. Now let's look at nutrition. So if I'm giving a diuretic that is going to excrete potassium, I want this patient to eat a potassium-rich diet. And the acronym that I use for potassium-rich diet is LAMBOS, and you can see this acronym here. Now let's talk about potassium-sparing diuretics, and the most common potassium-sparing diuretic you're going to see is spironolactone, and I like to use the saying spironolactone spare. So what this indicates is that when you administer a potassium-sparing diuretic, you're not going to have that excretion of potassium with fluids. You're actually going to retain that potassium. So it's in these patients that we want to avoid a potassium-rich diet, and remember, we use that acronym LAMBOS to remember our potassium-rich diet. I hope you learned something new. Follow for more.